Welcome back to the social. So, there's a lot of information out there about COVID-19, about cures and treatments. Some of it is legitimate, but a lot of it sounds a bit shady. So, to help us separate the facts from the fake news, we have Dr. Yoni Freedhoff back with us. Dr. Yoni, hi, how are you?
I'm doing okay. I hope you guys are too.
Okay, Dr. Yoni, there's so much misinformation out there right now. So you got to help us out, right? Like you have to sort of at least help us bust some of these myths. So let's start with the first myth, which is we've heard this a lot that COVID-19 is just like a regular flu. Myth or no?
Well, it's definitely a myth. Right now in the United States, for instance, COVID-19 is killing more people per day than heart disease and cancer. It is the number one daily cause of death now in the United States. It's killed thousands of more Americans in 1 month than a bad flu season does in 1 year. In Italy, they had to bring in troop transports to help remove the bodies. One out of every 800 people living in New York City have died from COVID 19, and that number is rising. And this past Sunday's Boston Globe had 16 pages of obituaries. This is definitely not the flu.
So when we first started hearing about this virus, Yoni, there were many outlets that reported older adults or those with pre-existing conditions were the ones that were susceptible. Has that proven to be the case?
So it's definitely true that the elderly are at the greatest risk of this virus killing them. However, we know that this virus is killing young people as well. And also, there are many young people who are getting ill enough to need hospital care, but who are ultimately making it out of the hospital. What we don't know, though, is are there going to be ramifications for those younger people who are sick enough to go to the hospital, but don't actually die from COVID? Because we know in hospital, COVID 19 does appear to be attacking their kidneys, their brains, of course, as well as their lungs. And whether this has long term ramifications for them has yet to be seen. The other thing that's important to note is that, yes, this may affect the elderly more often, but I'm quite fond of the elderly people in my life. I think that it is unreasonable to think that those elderly people want to die alone in an ICU or a long-term care facility. And that when we discuss sort of this is only affecting the older generation, I think it's unconscionable, especially here in this country where we're seeing just a terrifically tragic outbreak of deaths in our long-term care facilities.
There are those in the science world, some, who talk about this whole idea of herding, that not everybody should be isolating at this time. Only those with pre-existing conditions or those that are sick or, those who are at risk for this virus. So what do you make of that? This whole idea of herding, and that some say, you know what, reopen the schools. We should be working. Not everybody needs to isolate. What do you make of that?
Well, there will always be contrarians out there. So, right now, the consensus from the World Health Organization and others is that we need certain criteria to be met before we can really open things up again. First and foremost, of course, we need disease transmission that's under control. And for the most part, we're seeing improvements to that in Canada. We need healthcare systems that are able to detect, test, isolate, and treat every single case, as well as trace every single contact. We are not there yet here in Canada. We need to have minimized risk in our vulnerable places like our long-term care facilities. We need our schools, our workplaces, and essential places to have established preventative measures. We need to have some system in place to minimize the risk of people traveling to Canada. And we need communities that are fully engaged, educated, and empowered to live under this new normal. Until we have those criteria met, most are saying that opening up would be premature and that doing so would simply be resetting our clocks back to February and risking future lengthy lockdowns.
Okay, Dr. Yoni, here's something that was circulating online. And I know when I read it, I thought it was ludicrous, but I think there are some people out there who believe this, and that's the holding your breath test. So the way it goes is some people think that if you hold your breath for 10 seconds and you don't cough or feel any discomfort, it means you don't have coronavirus. What do you say to that?
So it's definitely a myth. And while for sure one of the very common presentations or symptoms of COVID 19 illness is shortness of breath, COVID 19 can present with a whole host of other symptoms from dermatologic changes, skin changes, there's something called COVID toes, to diarrhea, to loss of sense of taste or smell. And so being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean you are free from coronavirus or, quite frankly, any other lung disease.
All right, so here's one that is a little bit more difficult to discern if it's a myth, and it's the report that was going around. I saw it a few times, and it like was sent to me by friends and family about ibuprofen and how taking it is not good if you are presenting with COVID-19 symptoms because it could make things worse. Can you clarify on this?
Sure. So this stemmed from a letter that was written to The Lancet, a medical journal, in the very early days of COVID 19, and it was promoted by the Minister of Health of France. Since that time, however, we sadly have seen tens of thousands of cases of COVID 19, and we have not seen any strong evidence to suggest that the anecdote that was written about in that letter actually has any evidence base behind it.
Can we bring climate into the conversation now, Dr. Yoni? Because the weather is starting to warm up, and many believe once that happens, that the virus will kind of die off. People have pointed to warmer climates, different countries, the West Indies, for example, where the instances don't seem to be as high as they are in North America. Does climate have any impact on this virus?
So it's not likely to have any impact on this virus. Right now, we know that there are COVID 19 cases and outbreaks in virtually every single country across the globe from pole to pole. That's our hemisphere where it's just warming up, but also the southern hemisphere where it's already been warm. When we look at some other viruses related to COVID 19, like MERS, for instance, it was a virus that spread in the Middle East in the summertime. So there's no reason for us to expect this to change with COVID 19. It would be wonderful if it did, but that's just not what we're seeing right now on the ground.
Let's talk about prevention, or at least keeping our bodies strong. And what's out there is that people are being encouraged to take more vitamin C or a higher combination or a better combination of vitamins to help ward off the virus. What are your thoughts on that?
So there are no supplements that have been shown to help ward off COVID 19 or, frankly, any other respiratory virus. If you find someone claiming otherwise, especially if they are selling those supplements, they are either well intentioned and hopeful, but ignorant and misinformed, or worse, they're actually trying to steal money from you during a very scary time.
What about immunity, Dr. Yoni? Fact or fiction? If you've caught the coronavirus, you can't get it again. You are now immune.
Well, given that the coronavirus has only been around for a short period of time, we can't say for certain. However, if we look to other coronaviruses, including those that cause the common cold, SARS, and MERS, although people who've had the disease do develop immunity, it's short lived, from 1 to 3 years, it would seem. And those people can become reinfected. Now, it's possible their reinfections wouldn't be as severe as their original infections, but it is not something that we can count on as far as our future with COVID 19 goes.
Dr. Yoni, you've provided a lot of clarification today. So can you end on what we should be doing to stay safe?
So the best things that we can do, hopefully we're all doing, which right now would involve staying home, washing our hands regularly, especially if we're out, and living really the healthiest lives we can enjoy at home. So exercising as much as we can enjoyably do in our home locations, or certainly safely physically distancing ourselves, eating the healthiest diets that, again, we can enjoy, but respecting the fact that the healthiest lives that we can enjoy during the early days of a very scary pandemic may not be as healthy or as exciting as the healthiest lives that we can enjoy when life is steady, sane, and safe.
This is great information, Dr. Yoni. Thank you so much for joining us and for clarifying all of this. We're back with much more right after this.